day, everyone. I am Lourdes Jane Herdista Renablas, a Level 1 nursing student from the University of the Visayas. And in this video, I will be performing my return demonstration for vital sign taking, which includes taking the patient's blood pressure. Vital signs are defined as the clinical measurements that indicate the state of a patient's essential body functions. Blood pressure is the measurement of the pressure exerted by the blood as it flows through the arteries. The purpose and significance of taking the blood pressure is 1. To obtain a baseline measure of arterial blood pressure for subsequent evaluation, and 2. To determine the client's hemodynamic status. First is to introduce yourself to the client and verify the client's identity. Mayong adlaw, ma'am. Ako di si Jane, imong student nurse. Pwede ko mangutana, unsa ganito yung ngalan nimo, ma'am?
Mayong adlaw, nurse. Ako ngalan kay Sulel Riego.
Salamat, Ma'am Sulel. This is done to ensure that we are carrying out the correct procedure with the correct client. Next is to explain what you are going to do and why it is necessary. Ma'am Sulel, karon magkuha ta sa imong blood pressure. Ato aning pagkabuhaton aron madeterminar ang sukaran sa pressure sa imuhang dugo aron kini atong masusi o para madeterminar ang imong hemodynamic status. Nakasabot ra ba, ma'am?
Makasabot ra.
Salamat, Ma'am Sulel. Providing information to your client will minimize fear and anxiety, will foster trust, and will promote cooperation. Next is to wash your hands or perform hand hygiene. This is done to prevent the transmission of harmful pathogens during the administration of health care. Next is to provide for client privacy. If you are in a ward, be sure to place curtain drapes around the area of the bed. If you are in a private room, be sure that the doors are closed and adjust curtains if there are any. Providing privacy is the client's basic right. Through this, we can establish rapport and promote client's comfort and cooperation. Next is to place the client in an appropriate sitting position. Sir, pwede mo bakod ka, sir? Ang lingkod lang taning tumoy sa higdaanan, sir. This is done to ensure a precise and accurate blood pressure reading. Next is to make sure that both feet of the client are flat on the ground. Sir, pwede i-abot na ito ang tiil sa sound, sir? Okay, sir. Salamat. Improper leg positioning may alter the perception of the blood pressure reading since it can elevate the systolic and diastolic blood pressure. Next is to slightly flex the elbow of the client with the arms facing upward and the forearm supported at heart level. The blood pressure increases when the forearm is below heart level. The blood pressure decreases when the forearm is above heart level. Next is to expose upper arm. Sir, ako ang isa ka ning bukton si Masanina, sir, ha? Exposure of the upper arm will permit a better access of the brachial artery in order to attain accuracy in the procedure. Next is to make sure that the cuff is fully deflated and the valve moves freely. This is done to ensure an accurate and precise blood pressure reading in the preceding steps. Next is to locate the brachial artery with the fingertips. This is done to determine the location where the cuff and the diaphragm will be placed for auscultation. Next is to place the lower border of the cuff 1 inch above the antecubital space and place the bladder at the center directly above the artery. Improper cuff placement can alter the perception of reading the blood pressure measurement. Next is to palpate the brachial artery. Turn the valve clockwise to close it. And pump the cuff to 30 mm of mercury until the pulse disappears. Then release the valve slowly and note reading when the pulse is felt again. This is done to ensure that the cuff is placed in the proper placement and it gives an estimate of the systolic blood pressure. Next is to clean the earpiece of the stethoscope and ensure that the diaphragm hangs freely. Sounds are more heard or are audible when the earpieces of the stethoscope are clean. The diaphragm should hang freely because any object that can come into contact with the tubing can block the sound of the blood within the artery walls. Next is to place the bell over the artery. The blood pressure is a low frequency sound. It is best heard with the bell-shaped diaphragm. Next is to use your dominant hand to close the valve and pump to inflate until manometer Using your dominant hand improves dexterity. It will make it easier to handle the valve and pump the cuff to attain a more accurate blood pressure reading. Next is to release the valve at 2 to 3 millimeter of mercury per second. Releasing of the valve too slowly or too fast will create an error in the measurement of blood pressure. Note the reading of manometer at cuff faces to determine the systolic and the diastolic blood pressure. what I did earlier, I released the valve completely because continuous inflation can cause arterial occlusion, which leads to numbness and the tingling sensation in the client's arm. Remove the cuff away from the client's arm to allow the blood trapped in the blood veins to be removed. Next is to inform your client with the findings. Sir, imuhang result, sir, is 117/74, which is normal na siya, sir.
Salamat sa rebound nurse.
Okay, you're welcome, sir, and salamat po sa pag-cooperate. It is the client's right to be informed with the findings. This will promote cooperation and will foster trust during the implementation of a nursing intervention. Lastly, record the findings into the patient chart. Documentation provides coordination of care and facilitates ongoing data collection. A well-written and detailed record of the client will serve as a foundation of an efficient nursing intervention.